If you know these points, you can solve any of the laxative questions very easily. So stay with me to learn those things. Hello everyone, welcome back to my channel with another important video. So today we are going to talk about constipation and its management. Constipation is either hard stool or infrequent bowel opening. It means less than 3 per week. The causes include painkillers such as codeine, immobility, reduced fluid intake, and reduced fiber intake. Sometimes it may be also due to some kind of stress or excessive caffeine intake. But always keep in mind, especially in an elderly patient with constipation, there could be some serious conditions such as carcinoma of the intestine or intestinal obstruction. Today, I'm mainly concentrating on what are the things you need to consider when treating an elderly patient with constipation for your PLAB exam or any medical exam. Why I am concentrating more on elderly patient? Because it's very important to treat constipation. It not only causes very discomfort to the patient, but also it can cause fecal impaction or sometimes it may be the reason for delirium. Let's talk about the treatment options. A group of drugs we use to treat constipation are called laxatives. There are mainly four types of laxatives I'm going to discuss here. Those are bulk forming laxatives, osmotic laxative, stool softeners, and stimulant laxatives. Let's look at them one by one. So first one is bulk forming laxative. These are a type of colloids which are not digestible inside the gut, so they absorb a lot of water and become swollen. This increases the bulk of the stool. This eventually leads to distension of the GI wall and stimulate peristalsis. This necessitates an adequate amount of fluid intake with this type of laxative. So this is not a good choice when the patient can't drink a plenty of fluid, such as heart failure patients or renal failure patients. But this is useful as a prophylaxis of small amount of hard stools and constipations due to reduced fiber intake. Few examples are anal fissure, hemorrhoids, irritable bowel syndrome. But this is not very useful in established constipations. Bulk forming laxatives should be avoided in intestinal obstruction. We have some incredible videos and podcasts coming up every week. So if you don't want to miss them, please stay subscribed. The second one is osmotic laxatives. These keep water into the intestinal lumen rather than it get absorbed. So these need around 2 to 3 liters of water intake per day. This is not good in a palliative patient or elderly patient who are more prone to dehydration. The other reason for this is it will increase the abdominal bloating and flatus, especially when the patient is immobile. This also causes some electrolyte imbalance too. Osmotic laxatives are used in chronic constipation and it's a best choice for hepatic encephalopathy. Few examples of these are lactulose, sorbitol, and macrogol. The third one is stool softeners such as glycerol and docusate sodium. These have both softening and stimulant effects. Stool softeners make the stool softer by allowing the lipid and water to penetrate the stools. In this way, it helps to avoid straining during passing stools. So, few indications of these are hemorrhoid, fissures, and if the stool is rocky hard, even we can use it. Okay, let's discuss the final one. This is stimulant laxative. Two well-knowns are Senna and Bisacodyl. As the name implies, it directly stimulates GI motility. Senna works around 8 to 24 hours, but Bisacodyl, if it is used rectally, it can work within 1 hour. So it's used before colonoscopy or sometime for some surgeries. One well-famous side effect of this type of laxative is causing brownish discoloration of the colon. This is also known as melanosis coli. Alright guys, now you all know that stimulant laxatives increase the gut motility. So you should not use this in hard stools or bowel obstructions. The other disadvantage is it causes dependence. I think it's clear for you all about laxatives and when to use them. Now go and try to solve your medical questions using this knowledge. I hope you will find some difference.